Okay, I'm sanitizing my hands. Hello, Camden. My name is Zakaya, and I'm going to be your nurse for today. Today, we're going to be doing an assessment of your head and your neck to check for any abnormalities. If you could you tell me your name, your date of birth, and your age?
I was, my age is 6, my name is Kenny, and my birthday is August 13th.
Okay, correct. So we're going to begin the assessment by doing an assessment of your head to check for any protrusions or involuntary movement, the shape, and the size. The size of the head is good. The head is round. There are no protrusions, and there's no involuntary movement. Now I'm going to go on to palpate your head to check for any masses or lesions. Let's see. Okay. The head is normally hard and smooth without any lesions or masses. Now we're going to go on to do the assessment of the face. I'm going to begin by inspecting the face for skin conditions, involuntary movement, the symmetry of the face, and facial expressions. The facial expression is symmetrical. The face is round. There are no involuntary movements, and there is no abnormal skin condition. The skin is evenly about the same color. So now I'm going to go on to palpate the temporal arteries. So, okay. Is that tender? Does it hurt?
Nope.
Okay. The temporal arteries are elastic without any tenderness. Now I'm going to go on to palpate the temporal mandibular. If you could you open your mouth wide for me? Okay, close it. Open it. Close it. Okay. Did that hurt any?
Nope.
Okay. There isn't any swelling. There isn't any swelling or any tenderness. The mouth opens fully and closes fully, and as he opens his mouth, the lower jaw moves down laterally. So now I'm going to go on to test your cranial nerves, which is nerve 5 and nerve 7. Nerve 5 is the trigeminal nerve, and nerve 7 is the facial nerve. So to test the trigeminal nerve, could you close your eyes for me? Could you tell me what I'm touching?
I touch my forehead.
What's this? Close your eyes.
I touch my chin.
Close your eyes.
I touch my nose.
Close your eyes.
I touch my cheek.
Okay. So now we're going to test the facial nerve. If you could you smile for me? Cheese. Let me see your teeth.
Cheese.
Okay. Could you frown for me? Could you raise your eyebrows? Okay. Those nerves are good. So now we're going to go on to do the assessment of the neck. If you could you flex your neck like this for me a little bit? Okay. I'm going to assess for any protrusions or lesions or pulsations or masses. There aren't any of those. Okay, I'm going to give you a little bit of water, and I need you to swallow for me. Could you drink a little bit of that? Hold it in your mouth for me for a little while. Okay, now swallow. Okay, good. That's good. So now we're going to assess for the range of motion. If you could you move your head to the left and right, touching your shoulders? Touch your shoulder, make it touch your shoulder. Okay, move to the other side. Okay. Now I'll need you to make your chin touch your chest. Okay. Could you raise your head for me? Put your chin to the ceiling. Okay. If you could you put your ear to your shoulder on both sides? Okay, good job. So now that we're done with the range of motion, we're gonna go on to do the palpation. Okay. So I'm going to start by palpating the trachea and the thyroid gland. Okay. So could you flex your neck for me? Flex it a little bit. Let me palpate it. Okay. Okay. Now, if you could you stand up and turn around and sit down for me? And I'm going to palpate your thyroid gland. Okay, so you flex your neck for me a little bit. Okay, like that. And then I'm going to push with one side and press down with the other. Okay. Push with the other side and press down that side. Okay, good. Turn around for me. The trachea is midline, and the and the thyroid gland is midline as well. Okay, now we're going to go on and we're going to palpate the lymph nodes. I'm going to start with the preauricular node. Okay, now I'm palpating the postauricular node. Okay, now I'm going to assess the occipital lobe. Okay, now I'm going to go on to the tonsillar node, the submandibular node, the submental node. Okay, now I'm going to assess the superficial cervical node, which is in front of the sternus muscle. Okay, now I'm going to assess the posterior node, the posterior cervical node. Okay, now if you could you turn your neck to your right for me as I assess the deep cervical chain node. Turn your head to your right for me, as far as you can go. Okay. Okay, now turn it to your left. Okay, now I'm going to assess your supraclavicular nodes, which is right here above your clavicles. Okay, good. So now we're going to assess cranial nerve number 11, which is your spinal accessory nerve. Okay. Okay, so to test your spinal accessory nerve, I'm going to need you to test your spinal accessory nerve. I'm going to need you to turn around for me. Okay, could you shrug up in your shoulders? Okay, don't let me push down. All right, now we're going to do another method. So as I hold your head tight, I'm going to need you to try to turn your head to your left and to your right. Okay, to the other way now. All right, good. Okay. That is going to be the end of the assessment. There were no abnormalities found during the head and neck assessment. And that's the end of our video. Thank you.
Bye.